Dear student, this is the continuation of the image-based anatomy question which we have discussed in the upper limb part, question 1. Now look at the dissected area in the picture, and now tell me what is the name of the area indicated by the probe. What are the boundaries of it? Look at the whole dissected area and then answer. And what is its clinical importance? That is the clinical importance of this area indicated by the probe. So the name of this area, which is in the form of a triangle, is the triangle of auscultation, and the muscles that are bordering it you are seeing are the trapezius, the latissimus dorsi, and you are seeing the bone scapula. Now, what are the boundaries of this area, that is triangle of auscultation? And if you look at the picture, you are seeing the trapezius muscle. So the medial border for this area is the lateral border of trapezius. So what is the lateral border for this area? So you are seeing the scapula, the bone scapula, and then this is the medial border. So the lower part of medial border is forming the lateral boundary for the triangle of auscultation. The inferior border. So the inferior border or the inferior boundary is the upper margin of the latissimus dorsi muscle, which you are seeing here, the latissimus dorsi. And what about the floor of it? The floor of this triangle of auscultation is formed superficially by the rhomboideus major muscle. You can see the rhomboideus major muscle, and deep will be the 6th to 7th ribs with intervening intercostal space. So these are the boundaries of the triangle of auscultation. Now, what is the clinical importance of triangle of auscultation? That is the third question. So, if you look at the triangle of auscultation after learning about the boundaries of it, the thoracic wall in this area is relatively thin, and this triangle becomes enlarged if the person leans forwards with the arms folded across the chest. So this enlarges the triangle of auscultation if he folds his hands across the chest and leans forwards. The respiratory sounds can be heard clearly with the stethoscope, which is being placed over this area. So it is suited for auscultation. Hence it is called triangle of auscultation. So by looking at the dissection images, you have learned about the muscles and the bone that is forming the boundaries for triangle of auscultation and its clinical importance.